Now, the U.S. House has already passed a coronavirus relief package, and it's now heading towards the Senate.
Here to talk about all this is 7th District Congresswoman Abigail Spanberger. Thank you for joining us tonight, Representative.
Thank you for having me.
It's a shame that you're here for all this, but let's jump right into it. How will everyday Virginians be affected by the bill that's passed the House and now before the Senate?
So we've actually passed 2 appropriations bills thus far aimed at addressing the challenges of the coronavirus. The first was the week before last. That bill was focused on ensuring investment in vaccine production, ensuring non-interest, low-interest loans to small businesses, and really ensuring that we have some of the base foundational pieces funded for protective gear and investments in healthcare infrastructure. Then what we just passed late in the evening Friday night going into Saturday was a bill that gets at the impact on families and individuals. As the doctor mentioned, our goal, our legislation would ensure that every coronavirus test is free. Now, the challenge we are still facing is that it is hard to get a coronavirus test, but our goal and the legislation that we passed would in fact ensure that there's no copay, no deductible associated with that. Our bill would also ensure $1 billion in additional funding towards food nutrition programs with so many of the Commonwealth's children at home, out of school, and kids across the country. It's vitally important that our nutritional programs across the country can meet the needs of children. And then, of course, we are ensuring that families can do what's important to help protect themselves and others. So our bill included 14 days of emergency paid sick leave for millions of American workers. And that bill, we acted with urgency in the United States House. That bill is now before the United States Senate.
I know there's been some concerns. We have a lot of folks that are, they work by the hour and they're not quite sure when they're going to go back to work. What kind of relief can we expect next?
So right now, what our bill passed is related specifically to sick leave for those who are missing work because of an illness or to take care of a sick individual in their family, a child or a family member. And so those benefits are going to be based on their prior income. So if someone is an hourly worker, though working full-time, it would be rated at that time. If they're a part-time worker, those sick leave benefits would be at that level. We are in continued conversations within the House of Representatives about what additional efforts we must undertake to ensure the stability of American families and individuals nationwide. We are seeing across Virginia and across the country real significant challenges. I was on multiple conference calls just today with colleagues from across the country, and the impact is so significant. A colleague from Las Vegas was talking about with the closure of the NCAA and the fact that there will not be the games, the NCAA tournament games. Hotels across Las Vegas are shutting down, and it has that echoing impact. And we're seeing that across Virginia as bars and restaurants are either closing or slowing down. The impact on the workers across Central Virginia is immense.
Are there any concerns, Representative, about the capacity of our medical system as it stands right now to handle perhaps the influx of people who will be coming in with, as Dr. Abula described, varying levels of symptoms from extremely severe to less so to perhaps just normal kind of flu-like illness?
So among the challenges that I am hearing from our first responders, our healthcare workers, and I am so grateful to the healthcare workers across Virginia and across the country, but the challenges are multiple. So not only is there an increase in individuals who may actually be facing coronavirus, but when a hospital has to undertake real security precautions to ensure against spread of coronavirus, that impacts operations and their surge capacities across the board. So we're seeing hospitals across Virginia that are electing to move any non-essential surgeries, trying to free up space, ensure that there are not other individuals with elective surgeries in the hospitals. But I was speaking with an emergency room nurse just the other day who was saying on an average day they're giving about 100 flu tests a day. And so when they have all of these patients coming through presenting with flu-like symptoms, they're testing for flu, but in fact then the next step is one that is not always available to them, which is to actually deliver a COVID-19 test. And the impact that it's having on our nurses and our doctors and our medical professionals is really significant. It's changing the way they're delivering services to patients across the Commonwealth. And I'm so grateful to them for all the work that they're doing.
And we're grateful for your work in the House to try to mitigate all this stuff. Hope you and your family stay safe. And certainly when you're in Congress, be careful. We hope you guys are social distancing.